Happy Monday, everyone. Now, last week I kind of alluded to the fact that we're starting off with some impact pillar talk. We're talking about population health. Now, we talked like what is population health and what does it mean to focus on the triple aim? Just to review, the triple aim's three things: increased patient experience, better patient experiences. That means patients are happier in your office, patients are better engaged in their healthcare, they are taking a more active role in being healthy and taking care of their wellness. The second is lowered costs. So our healthcare system is ridiculously expensive. In fact, by 2026, that number, the 2027, excuse me, that number is going to be $6 trillion, more than 20% of our gross domestic product. We cannot afford that. Period. End of story. So improved patient experiences, lowered costs, and improved patient outcomes, that we actually are healthier. So that's what I want to kind of talk about today. A little bit more background information, some sobering statistics about the United States healthcare system. Do you think it's good? Well, look, it's better than a lot of places, but it's not as good as how expensive it is. We pay a ton of money, obviously $6 trillion by 2027. That's insane. Do we really get our money's worth? And unfortunately, the answer to that is no. A big, fat no. We pay too much. We don't get what we want. We don't get what we need, and that's to be healthier. Let's talk Medicare, for example. 2/3, 66.66% of Medicare beneficiaries have at least two chronic illnesses, and 16% have 6 or more chronic illnesses. If you look at the United States life expectancy, it's 78.8 years, and it's on the decline. We are behind some major countries: Australia, Japan, Canada, Switzerland, and more when it comes to our life expectancy. Do you know that we're 55th in the world in infant mortality rate? 55th. 54 countries you have a better chance of surviving the first year of life after you're born than the United States. Again, we pay way too much. So what does that mean? What does that mean going forward? We spend way too much money on healthcare. We need to lower those costs, but we need to be healthier. The healthier we are, the less we actually have to utilize big ticket costly healthcare services and costlier healthcare, the medications, the surgeries. The healthier we can be, and primary care providers like you and me as optometrists, dentists, primary care providers, physicians, PAs, and nurse practitioners, hugely important that we're taking the time to educate our patients on how to be healthy. So we're going to be delving more into the different aspects of population health. But again, our healthcare system is jacked up. It is way too expensive, and we don't get anywhere near what we pay for. I don't know about you, but that makes me unhappy. I need some better value in this healthcare system. So let's go. Have a great week.